Dentistry in General Advocacy Coalition presents 2025 ADA's House of Delegates Special Edition. Resolution 502. Transparency in dental practice ownership is not just an ethical issue. It's a matter of trust, integrity, and patient protection. Patients deserve to know who truly controls their care, yet current loopholes allow hidden corporate influence to flourish behind a facade of clinical independence. When ownership is obscured, accountability erodes, and the sanctity of the dentist-patient relationship is compromised. The rising tide of non-dentist entities controlling clinical decisions threatens to turn dentistry into a profit-driven commodity, where financial motives overshadow patient well-being. This is not the future our profession envisions, and silence is complicity. Resolved, that the ADA develop and advocate for model legislation requiring full disclosure of the beneficial owners of all dental practices to the public, including dentists and patients, in a clear and accessible format. Resolved, that the ADA urge all state dental boards to adopt and enforce regulations ensuring that clinical decision-making remains solely under the control of licensed dentists, free from interference by any non-dentist owners or entities. Resolution 503. Despite clear mandates in the ADA bylaws, national leadership has repeatedly disregarded the authority of the House of Delegates, undermining the very structure of representative governance that sustains the profession's unity. Public support for unapproved legislative compacts and backdoor agreements made without constituent consent have not only violated ADA policy, but have directly contradicted the positions of state dental societies, damaging trust and eroding the tripartite model. These unauthorized actions, including testimony that openly opposed constituent societies and partnerships that derailed grassroots legislative efforts, reflect a troubling pattern of top-down interference. When ADA leadership acts without transparency, it betrays both the ethical code and the foundational principle that our members, not staff or outside groups, should chart the path of dental policy in our association. Resolved, that the American Dental Association shall not assist any organization, agency, group, or individual who is attempting to alter the laws of a state without the written consent and approval of the constituent society. Resolved, that the ADA shall require that all legislative initiatives, partnerships, model policies, compacts, or public advocacy efforts with external organizations be formally reviewed and approved by the House of Delegates before they are publicly promoted or implemented as official ADA policy. Resolved, that the association shall support constituent societies when asked to collaborate in state-level advocacy, and shall provide timely guidance if proposed legislation may impact ADA policy or the public interest. Resolution 504. Members have voiced urgent concerns that ADA communication channels are drifting away from the values and policies adopted by the profession, allowing controversial staff-driven narratives to dominate without balance or oversight. Editorials and news pieces have elevated business-driven models, such as value-based contracting, third-party ownership, and corporate-affiliated DSOs, that reduce dentistry to a transactional service and erode the doctor-patient relationship. Such unchecked messaging threatens public trust, compromises professional autonomy, and risks reshaping dentistry into a commoditized industry where care is measured by volume and profit rather than ethics and patient well-being. When ADA-branded platforms present these models as desirable without counterpoint, it not only undermines neutrality, but also places the association's reputation and ethical foundation in jeopardy. Resolved, that ADA staff, including dentists employed in staff roles, shall not use official ADA communication platforms, including publications, email communications, websites, or social media accounts, to publish or promote content that conflicts with policy adopted by the House of Delegates or may reasonably be perceived as undermining the independence of the dental profession or reducing it to a transactional model of care. Resolved, that the Council on Communications shall serve as the editorial oversight authority for all ADA public-facing and member-facing non-scientific content, including but not limited to JADA, ADA News, ADA.org, email newsletters, social media, and other communications platforms, ensuring such content reflects House-adopted policy and adheres to established standards of editorial integrity. Resolution 506. The ADA Board of Trustees holds the responsibility of protecting the future of our profession, and that responsibility must never be compromised by politics. When trustees or the speaker are allowed to campaign for higher office while still serving, every vote, every statement, and every decision risks being influenced by personal ambition instead of what is best for the association. That erodes trust, damages transparency, and casts doubt on whether governance is being carried out for the members or for a campaign. By requiring a pause before any trustee or the speaker may seek elective office, we free our leaders from political calculation, ensure that their focus is on fiduciary duty and mission, and demonstrate to every member that decisions are made with integrity, loyalty, and complete transparency. This change makes clear that leadership positions are earned through service, not maneuvering, and that the ADA's elections are grounded in fairness, honesty, and respect for the profession we all serve. This resolution amends the Election Commission and campaign rules to bar current members of the Board of Trustees, the Treasurer, and the Speaker of the House from announcing candidacy or engaging in campaign activities for ADA elective office until the adjournment of the House in their final year of service. It further amends the Governance and Organizational Manual to enshrine this eligibility restriction and sets implementation to begin at the close of the 2025 House of Delegates. By adopting this change, the ADA is making a powerful statement that governance must be free of personal ambition, that elections must be fair and transparent, and that the highest offices of our association are reserved for those who have completed their service with full loyalty to members, not with divided attention to their own campaigns. Resolution 507. The dental profession now faces one of the most egregious assaults on fair competition in recent history, as allegations emerge of a coordinated scheme among powerful insurers to suppress reimbursement rates and manipulate market forces to their advantage. Dentists across the nation report being trapped in a system where unilateral repricing decisions slash fees without warning, undermine patient care, and erode the viability of independent practices. This pattern of conduct has left practitioners with little recourse, forcing them into a marketplace tilted heavily in favor of insurers whose consolidated power threatens both professional autonomy and patient access to quality care. The stakes of this litigation extend far beyond financial disputes. They strike at the heart of whether dental care will remain a competitive, patient-focused profession or become further dominated by corporate interests. Resolved that the Board of Trustees be urged to formally support the plaintiffs in the federal antitrust case, Zealous Repricing Antitrust Litigation. Resolved that the ADA collaborate with plaintiffs' legal counsel to share relevant data, develop expert reports, and where appropriate, submit or support legal filings, such as amicus briefs, in order to protect the interests of dentists and restore competition to the dental insurance market. Resolved that the ADA utilize legal, public affairs, and health policy institute resources to urge the U.S. Department of Justice and Federal Trade Commission to investigate alleged collusion and market manipulation in the dental insurance industry, consistent with the authority granted under the Competitive Health Insurance Reform Act of 2020. Resolution 509. Advocacy is our profession's lifeline, yet millions have been wasted on hollow federal wins, while real member priorities, like insurance abuse, are ignored. Dentists are drowning under network leasing scams, virtual credit card fees, and shrinking reimbursements, while ADA chases strategies that don't work. If we fail to fully fund advocacy, shift power to state-level action, and make insurance reform our flagship fight, we risk losing not just influence, but the trust and future of our profession. Resolved that the American Dental Association shall protect and maintain all existing advocacy funding and shall increase such funding annually by at least the Consumer Price Index, CPI, or comparable inflationary measure, and shall target an annual advocacy investment of at least $25 million within 5 years of the adoption of this resolution, unless an extension is authorized by the House of Delegates through a resolution submitted by the Finance Committee. Resolved that the ADA shall fully fund and staff its Government Affairs Division at levels sufficient to support both federal and state initiatives, and shall redirect no less than 80% of its advocacy resources, including but not limited to staff, contracts, consultant services, travel, lobby day expenditures, policy development, media campaigns, and research, towards supporting state-led legislative efforts that address issues specific to each state's needs and priorities, and shall structure SPA grants and other state-level funding support based on strategic alignment with mission-based legislative objectives, with documentation of planning, execution, and measurable outcomes required as a condition of future disbursements. Resolved that the ADA shall prioritize insurance reform as a core component of its advocacy strategy and shall dedicate no less than 30% of its total advocacy budget annually to supporting state and federal efforts that address insurance-related legislation, including but not limited to network leasing abuses, third-party payment practices, lack of fee transparency, and advancing meaningful dental loss ratio reform aligned with House of Delegates policy, as well as other member-identified insurance concerns. Resolution 517. Dental insurance companies have long hidden behind complicated formulas that make their profits look better than the care they actually deliver. While the ADA took an important step last year with Resolution 306H, we now see that the policy still leaves gaps that insurers can exploit. Every dollar that is diverted away from patient care toward marketing, bureaucracy, or bloated reserves is a dollar stolen from the patients and dentists who fund these plans. Without clear standards, transparency, and accountability, families continue to pay for coverage that fails them when they need it most. This is not just a financial issue. It is about fairness and trust. Patients pay their premiums believing that money goes toward their treatment, not toward inflated executive pay or hidden administrative costs. Dentists fight daily battles with carriers that deny care while reporting misleading loss ratios. When insurers are not required to disclose exactly where the money goes, the system tilts against both patients and providers. The ADA must close the loopholes, set plan-level standards, and demand the transparency that our profession and the public deserve. This resolution strengthens ADA policy by requiring that dental loss ratio benchmarks apply to each individual insurance plan, not just market averages, and by mandating full public reporting of how premiums are spent. It ensures that when insurers fail to meet the 85% or 83% thresholds, they must return the difference to patients in the form of rebates. Most importantly, it addresses the critical missing piece: correct implementation. Without enforceable, plan-level standards, loss ratio policy is meaningless. By closing this gap, the ADA sets a framework that lawmakers and regulators can actually apply in practice, giving us a powerful tool to hold insurers accountable and guaranteeing that premiums are directed to patient care, not lost in loopholes. Resolution 519. For too long, most ADA members have had no direct way to bring their own ideas into the House of Delegates. Unless you are a delegate yourself or willing to navigate the layers of constituent or component societies, your voice is filtered, delayed, or sometimes silenced before it ever reaches the floor. This discourages innovation, strips away urgency, and leaves members wondering if their association truly represents them. If we want the ADA to remain the leading voice for oral health, we cannot afford to block the very people who make up its foundation from shaping its future. The ADA's own strategic plan calls for increased participation and broader representation to strengthen our leadership role and secure our future. Opening the door for members in good standing to submit resolutions is not a risk. It is a promise kept. A promise that every member's perspective matters and that grassroots voices deserve to be heard alongside those of councils and trustees. By empowering members directly, we build trust, foster engagement, and remind every dentist that this association is theirs to shape. This resolution does exactly that. It amends the standing rules so that any 3 members in good standing may co-submit a resolution directly to the House of Delegates, with safeguards to ensure proper formatting, deadlines, and reference committee review. It guarantees that leadership cannot block, delay, or alter those submissions. In short, this resolution empowers members, expands participation, and ensures that the ADA's governance reflects the voices of all its members, not just a select few. Resolution 520. The ADA Board of Trustees makes decisions that shape the direction of our profession, yet members are too often left in the dark about how those decisions were reached. Yes, the individual votes are recorded, but without an explanation of the reasoning, it can appear as if debate was limited, or worse, that no debate happened at all. This lack of transparency erodes confidence in leadership. Members deserve to know not only what was decided, but why it was decided. Without that context, trust is replaced by speculation, and speculation fuels disengagement and declining membership. Other respected institutions, from Congress to the Supreme Court to the American Medical Association, already publish majority and minority reports to ensure accountability and preserve the record of dissent. When we fail to do the same, it sends the message that the ADA is less transparent than the organizations we look to as peers and partners. Transparency is not a luxury or a talking point. It is the foundation of trust. If members cannot see the reasoning behind critical decisions on policy, finances, and governance, we should not be surprised when they feel disconnected from their association. This resolution establishes a member-driven process to ensure transparency in the decisions of the ADA Board of Trustees. It provides two clear pathways for significant categories of action, such as policy changes, insurance reform, interstate compacts, legislative advocacy, major financial transactions, and governance structure changes. Any member in good standing may request a majority and minority report for up to 12 months following the vote. For all other matters, members have 60 days to submit a request. Once requested, the board must prepare and publish the report within 30 days, making it available both to members and to the public. By producing reports only when requested, this approach balances fiscal responsibility with the need for accountability, ensuring that the reasoning behind important decisions is documented and accessible. The current ADA campaign rules are riddled with inequities that undermine fairness and erode trust. Rule 6 creates a campaign hierarchy that rewards insiders and incumbents, granting them full access to delegates while shutting out those who announce later, a blatant contradiction of our ethical duty to justice. Even worse, Rule 8 hands a single candidate the power to silence others by vetoing joint forums, depriving members of diverse perspectives and robbing delegates of their right to informed choice. Meanwhile, the unregulated spending arms race has spiraled out of control, with some campaigns exceeding $150,000, turning leadership opportunities into a privilege for the wealthy rather than a platform for vision and merit. These systemic flaws don't just breed inequality, they threaten ADA's integrity, expose us to legal risk, and betray the core values of inclusion and transparency our profession claims to uphold. This resolution replaces the current ADA election and campaign rules with a unified, modernized framework designed to promote fairness, expand access, and ensure compliance with nonprofit governance principles. It equally empowers all candidates, regardless of announcement timing, wealth, or connections, and protects the American Dental Association's integrity as a national professional association. For generations, American Indian and Alaska Native communities have suffered the deepest oral health disparities in the United States. These are not abstract statistics. They are families and children left with sporadic care at best. Tribal nations have developed their own culturally appropriate and proven workforce solutions to meet this crisis. But ADA opposition created federal restrictions that stand in the way. To deny sovereign nations the right to care for their own people is not just unfair, it undermines the very principles of justice and autonomy that dentistry should uphold. This is not about expanding dental therapists across America or changing ADA policy on non-dentists. It is about respecting tribal sovereignty and recognizing that these nations are training their own people for their own usage within their own health systems. Just as we would never presume to tell another sovereign country how to deliver healthcare, we should not deny that same respect to sovereign nations within our borders. By honoring their authority to make workforce decisions that work for them, as evidenced by the Alaskan Natives model, this resolution makes that respect clear. It amends current ADA policy to state that dentists shall perform surgical and irreversible procedures except when such procedures are authorized and regulated within the sovereign health system of a federally recognized tribal nation for the care of its own tribal members. It further clarifies that the ADA's policy on allied dental personnel shall not apply to workforce models wholly governed by tribal nations under their sovereign authority for the delivery of care to their tribal members. Finally, it commits that the ADA shall not oppose tribal efforts to change federal statutes restricting their authority.